European Innovation Partnership on Healthy Aging is a new way of making policy. Instead of deciding at a central level, top-down, what are the best solutions, we are looking at what exists in practice. Is a kind of bottom-up approach, and we look in reality what exists, and we try to scale up and to diffuse the knowledge around all the region of the European Union.
The EIP has a really important role to broker interests and sectors and expertise around active and healthy aging. That's, I think, what we've been seeing and what's happening at the regional level, at the national level, and at the European level.
Two things. First of all, our good practices. We now have over 90 from across Europe, looking at how people are successfully taking forward integrated care. And also the membership of our action group continues to expand and grow.
We have been building up a module for the screening, treatment and monitoring of frailty and pre-frailty, in which we distinguish which is a part of the screening and which is a part of the monitoring.
Our action group that is working on adherence to treatment was able to collect 61 good practices from 10 member states and more than 68 institutions. And these good practices can be an inspiration for other regions that have similar problems.
We in Coimbra by now have managed to have more than 40 different organizations dealing specifically with active and healthy aging, ranging all the way from R&D facilities to incubators, to science parks, to private companies and entrepreneurs, and overall they have created more than 500 different highly qualified jobs around these activities.
The EIP has played a key role in bringing together strategy planners from both the public and private sectors. By bringing together key decision makers, we have been able to bring about projects which have had a major impact in different European regions to improve quality of life for European citizens.
EIP has been helpful in Scotland for integrated care. We currently have legislation going through our Parliament that will enshrine integrated care in law. But being part of the EIP allows us, at the grassroots level, to speed up that process of integrating health and social care.
The EIP has been pivotal to Wales's development of its Ageing Well in Wales programme, a partnership programme across public, private and third sector organisations in Wales. It's our contribution to making sure that all people in Wales have an opportunity to age well and have lives that value meaning and purpose.
We hope that the innovation partnership could support French initiative, French technologies for innovations for elderly people, for industries, from startups, middle companies or big companies, that helps to promote this industry for autonomy, this industry that we like to name silver economy.
It's difficult sometimes to find fresh funding and money to invest in doing things in a new and different way. Also because the investment is made in one part of the value chain and the benefits might accrue somewhere else. And overcoming that would be a huge, huge impetus to getting more innovation into healthcare, into telecare and into active and healthy aging.
The smart specialisation strategies are being prepared by member states and their regions, and the objective of this is for them to identify those areas for research and innovation on which they want to concentrate resources in the next programming period of the European Regional Development Fund. What I would advise the partners to do would be to look to see where the regions and member states are, which have identified health issues as being one of the areas on which they want to focus their efforts for research and innovation in the next round of the funding from the European Regional Development Fund.
For the next year, it's making some of our findings public, producing a framework and a mapping of integrated care across Europe so that people know where to go, to twin, to partner, to lessons learned, to drive this agenda forward at scale.
We need resources to further create what we call a repository of information for interoperability, and also to have research labs, living labs, contribute to this repository of interoperability information.
We want to implement and upscale these best practices for fall prevention and management across different regions in Europe.
We hope to be able to mobilize even a greater network of stakeholders, including local and regional authorities, to promote the model of WHO of H1D environments, to support active and healthy aging, and we hope to be able to launch a covenant on demographic change to support this movement.
Since we have agreed on a direction, we need to take this direction next year.